Hi, my name is Dr. Kathryn Wisser, and I'm a gastroenterologist here at Logan Health. Colorectal cancer is the development of malignant cells, usually in a polyp form in the colon. You can kind of consider polyps looking like little warts on the inside of your colon, and what my job is to go in and remove those. We don't exactly know how many of those turn into cancer and how many of those just remain as polyps, but we have realized that removing these has reduced the rates of colon cancer in the United States. Colon cancer is, depending on what study you look at and what year it is, it's either number 3 or number 4 for the most common cancer in the United States. So risk factors for colon cancer that we're aware of is hereditary, something that you've inherited from your parents, obesity, smoking, drinking alcohol, diabetes. We know that these are risk factors, and there's something that we are exposing ourselves environmentally, and usually it's related to what we're eating. We know that processed meats, red meats seem to be a trigger. So when you're talking about prevention, now you're talking about reducing weight, staying away from alcohol, stop smoking, controlling your diabetes, and then altering your diet, avoiding those things that are processed, red meats, eating higher fruit, vegetable content, improving your fiber intake, and then physical activity. So we've also known that being more physically active has seemed to be really protective. One, it can be nothing. You can have no symptoms. And that's why we screen people starting at 45. And if you have any risk factors, I would tell you to come in sooner. Things that would and should draw your attention to your primary care doctor: bleeding, abdominal pain that is new to you and doesn't go away, change in the caliber of your stool, change in the shape of your stool, development of constipation when that's something new for you. Weight loss certainly should draw attention. If it's caught early, it's very treatable. Some colorectal cancers you have to have a surgical resection for. If it's caught in later stages of colon cancer, then you're talking about requiring either chemotherapy or radiation prior to resection, or vice versa. You have the surgery first and then the chemotherapy or radiation to follow. If you have a strong family history of colon cancer, and you're young, in your 20s or 30s, you probably should see a genetic counselor and find out what that risk factor is for you. You may need to have a colonoscopy as early as in your 20s. For routine screening, somebody who has no family history and is otherwise healthy and no bowel issues at all, I would say 45. That is our recommended screening guidelines at this point, because colon cancer has developed in much younger people, and that is a trend across the nation. So testing process for colorectal cancer can look differently for different people. You can have a take-home kit that your primary care doctor gives you. You can have a kit that's sent to you in the mail. Both of these are just diagnostic, and they're either looking for blood or they're looking for DNA that's related to polyp or cancer formation. You're not going to get any therapeutics done from this. Nobody can take those polyps out or give you a diagnosis from these kits, but they can tell you, hey, you need to have the next step, which is a colonoscopy. Colonoscopies would be the test of choice because it's not only diagnostic, but it's also therapeutic. We find a polyp, we find a mass or a lesion, we can address it at the time that we're looking at it. Provide you the most information, the least frequent screening that you would have to undergo if you do one of these test kits that come to you in the mail. It's anywhere from 1 year to 3 years. For colonoscopy, if we don't find anything, it's usually about 10 years before you need another screening test. Some people fear that when they do the prep, they're worried about, well, are my kidneys going to be okay? Is my diabetes going to be okay? Am I going to get dehydrated? We have a lot of work that's been done around preps to make this safe for people with diabetes, safe for people with renal dysfunction, or people that are worried about getting dehydrated. Most people tolerate it just fine, maybe a little bit of nausea. If it's around the procedure itself and it's the anesthesia, some of these cases can be done without anesthesia. That is entirely possible. If it's having a scope and you're worried about the risk of bad things happening, bleeding, or a hole where it shouldn't be, these are exceedingly rare, whereas colon cancer is very common that I would tell you the risk of putting yourself through those procedures is very low in comparison to the benefit of finding out and managing your screening symptoms. So.